And Maja Chmielewski, father and daughter team from Poland. And I've asked them to come and share their perspective on edentulous full arch treatments, ProArch, and related specifically to digital workflows. So before we begin, I would like to take an opportunity and have you guys introduce yourselves. So Dr. Maja, please tell our audience a little bit about yourself and your background.
I'm a brand new clinician, but I also do my prosthodontics. I take care of dental technology and of practical implementation of digital protocols in our lab and in our clinic. I'm a co-diagnostics trainer, so we run courses on the software and show people how to implement the digital in the world.
Very good. And from what I gather, you are a graduate of Medical University of Warsaw.
Yes.
And you were a researcher in the Pascal Manier clinic in California.
That's true. I had the honor to do so.
And you have some experience in Cad Cam technologies. Sarah Kamangirbach, would you share?
Yes, I've been doing my dental technology work for the past 5 years, and I've started with Cad Cam some 2 years ago. I can do anything basically from the scanning and planning until we mill the restorations and deliver them finally to the patients.
Beautiful.
So
thank you, and thanks for joining me. Now, Dr. Kris, share with our audience a little bit about your background.
I graduated in 1993, and I am dentist and specialist in implantology. I have a master's degree in implantology, and from 1996 we run our private practice. We have right now quite big team, big clinic, with research center, with laboratory and lecture room that we can educate the people. But nowadays we go completely 100% digital, and we are 100% guided in the surgery. So this is for us very important and interesting topic for the future.
Very good. And Dr. Kris, you are an ITI fellow.
Yes.
And you have a master's in oral implantology. You're a visiting lecturer at Frankfurt University.
Yes.
Correct?
Yes, that's correct.
And you also are a graduate of the Kois Center in Seattle.
Yes.
And you have dental
photomaster. Actually, I am deep in love in photography, and over the years with my team we created dentalphotomasterwebsite.com. Just you can check it, visit if you want to learn dental photography.
See, I wasn't going to let you not do that one. Okay, let's start with some questions. I would like to start with you, Dr. Maja.
Sure.
So you mentioned that you are a fully digital office, you guys mentioned. So I want to know what digital tools you use for your clinical practice.
So the first thing I have to recommend that I have to say is that the most important part to start with is the planning software. I really do think it's highly overlooked, but we'll get back to that and what you can get from it. And the second part that is coming up and getting bigger and bigger is the guided surgery. And especially as I'm a young clinician, it gives me a lot of reassurance and a lot of comfort in my practice and in my beginnings, because I can get to know the patient better and I can plan my cases properly, and they go fluently from the beginning into the end. So what I have to say about the planning softwares is that they don't only allow you to put the data together. So you merge the CBCT with the model, with the virtual model, and you can start with reverse planning. So you start from the perfect implant positions regarding the teeth. Then you can not only pick your implants.
Driven.
Yes, exactly, prosthetically driven. Because I'm a young clinician. I'm prone to making mistakes, and I want to make as little of them as possible.
Yes.
Not to wrongly position the implants and make my life harder with the design of prosthetics. So in the software, I can choose from about 8,000 nearly implant models, including Straumann. As you can see, the BLX cases on the co-diagnostic screenshot. And what we can also do there is to choose the abutments. So before I even touch the patient, I have the full protocol. I know what to do exactly in which moment of the surgery. And then when I implement it, I'm fully assured that I know what I'm doing. At least, skipping the mistakes that are very possible in the beginning. Another thing is also that If you work digital, you are able to superimpose the data to see how much mistakes you're doing. So then the software allows you to measure the positions of implants, and we can get the accuracy on the implant apex even of up to 0.1 or 0.2 millimeters of the discrepancy between the plan and the actual position. So it can be very, very precise because it's impossible to place it like this freehand. And another great thing is that in the software you can measure the angles between your implants. You can choose the abutments properly. You can choose the angulation of the abutments. You can choose the gingival height, and you can choose the type of the abutments with regard to SRA abutments or others. And then you can also position them in the way that you're sure that the PMMA temporary will fit.
Going to fit, exactly.
So you're sure that your occlusal surfaces are right where they should be, and your implants come out right where they should go. Another thing that you also get from the software is when you plan the gingival, the surgical guide, is that after planning the cylinders, the T-sleeves that you see on the screen right now, you can have the surgical protocol ready. So the software calculates for you which burr you should use with which T-handle, and that is also a way of double checking for us. So first thing is I'm putting the protocol on the screen in my clinic during the surgery. I have all the implant lengths, all the drill lengths, all the diameters on the plan. And it's a way for us to double check if we're placing the right tools in the right places.
Yes.
To minimize the mistakes so that it's the most comfortable procedure possible for the patient. It's also shorter, and it gives me a lot of comfort and stability, especially as a young clinician to start with.
When I graduated from the Arthur A. Degoni School of Dentistry in San Francisco, shout out to my school. My dean, Dr. Degoni, used to say, "You are just safe beginners." So congratulations on recognizing that and doing what you need to provide great patient outcomes.
Thank you very much.
Now, Dr. Kris, you have a case to share with us about the BLX implant system related to ProArch edentulous care. I would like to hear you share that with us.
Actually, BLX implant is really great tool, especially for the clinicians who are focused on the immediate loads, and the design and the type of restorations which you can deliver immediately after surgery is the thing which I was looking for the certain period of time. So with these solutions, what we have right now, you can plan with confidence the restorations which will be dedicated to the patients with full mouth reconstruction. Doesn't matter if it's with hard or the soft bone. So the beauty of the design is that actually in any type of the bone, you are able to reach very high primer stability. You have to even control to not over torque it. You have to be precise and careful what you are doing, but the results and what you will get the impression for the first time is unique. When you will try it, you will love it for sure. And I like as well, especially with the solutions which are improved for full mouth reconstructions, what Straumann changed in the design of some of the elements, of some of the components. And I think it is as well with the respect to the clinicians, the abutments, especially for the screw restoration, screw abutments. They have the design of the platform the same as it was in the past. They are slimmer, they are nicer, in a meaning that they adopt better in the bone, in the bed, after preparation, immediately after implant insertion. So we will not have this regular issue which we have, especially when we position tilted implants, where we have to use the special drills to reduce the bone just to have better platform for the abutment. So now with this slim design, it's really much better. And I have to admit as well, there is one more feature I like very much, which is the connection. It's quite a big change, because we can immediately realize that there is one type of the connection which fits all sides of the implants, and this is as well beautiful and respect to me as a clinician. I don't have to have a big stock of elements, components, so it's really very important. And when we compare this older version of the abutment and the newer version of the abutment, you realize that there are some changes, but the platform remains the same. So all the components which I was using until now for the impressions, when Maja is preparing some stuff, then we stay in the same with the same procedures. I don't need to invest additional money. I like it.
And do you also like the slimmer profile of the SRA? Because it allows
yes,
better
absolutely.
tissue
Because then it lets you emerge inside the implant, even with the small opening in the bone. Just you place an implant, you have access, and when you are placing it, you have immediately impression that someone took care about this design just to fit it so nicely.
Yes, and I really like your point about the one connection, the torque fit. Because in practice, I was a general dentist, so I had to have, depending on my surgeons that I worked with, pretty much all kinds of dental implant systems to offer for restorative parts. And the idea of one connection, simplifying the component parts and inventory management and training for myself, for my team, really great feature. Thank you so much for sharing that. Now, Dr. Maja, let's talk a little bit about what other tools you use to help in terms of precision, to increase your precision, because you mentioned a little bit earlier that 100% of your surgeries are done.
Yes, exactly. We work fully guided. So we do start from the scanners. There is both intraoral scanners and lab desktop scanners in our clinic, and they all work and they all have their ways. So if we know that there's a big a gap on the distal in the mandible, we're not bothering to scan it with an intraoral scanner. We go for an impression and we scan it with a lab scanner. But we work both on 3Shape and then on the IO. And then that's something that will really improve the quality for the patient, I would say, because especially the patients who have gagging reflexes and it's not very comfortable for them. The IO especially has a very small tip, so it helps them a lot. And another one I have to say is that the Cad Cam software for us does the job, because if you see your preparations in a magnification so big, it's a different story.
Yes.
It's a completely different story.
It's a humbling experience, isn't it?
Exactly. And you don't even need loops to do that, or a microscope.
No, you don't.
No. You see everything.
Oh, God.
Yes. So the software allows us to pair up our implants, our impressions with the proper abutments, and then we just Cad Cam mill in our milling machines after the design and Cad Cam the temporaries for our patients. But what is really worth mentioning also, I'd say, is the synergy, which is a connection between the planning software and the Cad Cam software.
Yes.
So your lab can actually see what is happening in the planning software, and they can adjust the prosthetic design accordingly. Yep. So that helps our team very much, because it's always teamwork, and that's the most important part. I have to tell about.
Yes, especially for pro-arch treatment for edentulous care.
Exactly.
Now, thank you so much, Dr. Kris. You are also a user of our 3.3 narrow diameter BLT for pro-arch cases.
Yes.
And I hear you have some things to share with us on this.
I think this solution what we have right now for some of the cases, it's very important to have the correct tools and elements, because without it you cannot provide all the service to every patient you would like to. So for me, one of the very important elements in planning some of the limited cases is to have the correct size of the implant, not only in the length but as well diameter. And we know all that smaller diameter means less strong material. So you have to understand why you can use it right now. And especially with narrow implants, NC 3.3 millimeter, I rely because it's rock solid. So we have this alloy, titanium with zircon, which is like 20% stronger than class 4 grade titanium. So immediately in such a demanding cases where you have limited volume of the bone, where you have narrow spaces, you can with trust place an implant and load it, like in the cases which you see right now on the screen. And in such a case, especially in the mandible, which I present right now, we have the situations where we have to implement guided surgery, for instance, with different type of guides.
Right.
To enhance the precision, it is always nice to support your planning with the right software, which will let you integrate data from DICOM, from your cone beam scanner with STL files, where based on the simulations you can position the implant and position it according as well, not only to the reach position, but as well future restorations. Because if we load immediately, we would like to create the temporary restorations for immediate load, which will fit.
Yes,
and if we have
course.
a lot of bone, wide reach, it is not a problem.
Right.
The more narrow we are,
It's not the easy ones that give you trouble.
yes, absolutely, I agree. And the more complex cases, the more difficult one, then you have to have more reliable instruments and elements, starting from drilling until you place an implant. So in such a cases, we go as well fully digital.
Yes.
We plan the cases with the bone reduction guides, so we can fix these guides on the bone, so we have stable and rigid position of the guide. And based on the position, we as well establish or plan the plane for bone reduction, and it will be as well a starting plane for us to place and position implants. So everything we do step by step in the planning. Maja is supporting me a lot in these things, so she is responsible for the digital in our team to implement and integrate new things. And for her as a young clinician, it is as well very important to understand why the planning is so critical, but as well to understand the surgical concept. Because guided surgery without surgical knowledge can be very dangerous.
Yes,
and we
that's
have
right.
to admit that it's just a tool. And if you will not follow surgical protocols, if you will not follow the rules, you will experience the problems and our patients will suffer. So it's very critical to go step by step. And like in this case, we can even sometimes create 2 free guides, or we create so-called stackable guides to be able to run with the correct procedures. Modern technology like 3D printing, milling allow us as well to create, based only on the planning, we can create the models with implant analogs. We can implement and plan and mill temporary restoration, where we can later on during the surgery just go like step by step, like with the Lego or puzzle game. This is a beauty. Because in the past it was for us more challenging with prosto than with surgery. But nowadays, if we plan everything correctly, we can have the situation where we plan implants accordingly, and based on the digital plan, we can as well deliver immediately after temporary restoration.
Right.
The dream would be just to insert immediately screw-retained restoration, which is prepared for you. Still, there are some things which needs to be improved over the next couple of years, I think, and it will be whole protocol possible that we will start with the surgery and deliver immediately after screw-retained restoration in an easy and nice way, because it's less time, less pain for the patient, and of course more comfort for everyone.
And thank you for mentioning rock solid. I agree. The idea that we have less potential fractures over time. I don't have to tell any clinician out there the value of not having a fractured implant. Perfect. Thank you so much. And Dr. Maja, so you mentioned, of course, guided surgery for ProArch, and I want to know, how did you implement this in your practice, and what were the requirements to start with guided surgery for your ProArch
so
cases?
this is something you really have to know, is that it's not so hard to start guided.
Right.
Because clinicians very often are scared a little bit of the digital protocols, because it's something that they feel is expensive and has to be complicated. Well, it's not. You start off with a CBCT that you would normally do anyway to plan your case. And then again, on the CBCT, it is superimposed in a digital planning software together with the models. If you don't have the planning software, you can find the digital planning center that will do it for you. And it will do it accordingly to your plan. And another case is scanning the models. So it is exactly the same as you would normally do. You don't need an intraoral scanner to start with. You can just take the impression, pour the model, and send it over to the lab that will scan it for you. In that way, you don't need a full locker or full wall of your impressions, especially if you're an orthodontist. It can be really cumbersome. And then you store everything on your hard drive.
Right.
It helps very much, and it's so easy to just get into the protocols. When you're ready, go for a digital planning software of your own. Then you have to think about the drill guides that you can prepare them, because not all the softwares are the same.
Right.
And the important thing is also that there is support for that.
Yes.
Not all the softwares are the same. All the manufacturers will make it look very simple and easy when you want to buy it, but then you have to work with it.
Yes, of course.
So anytime you're lost, you can just go through a video, through a webinar, or through the book, so that you can be comfortable with your beginnings.
Very good. Thank
Sure.
you. And speaking of books, Dr. Kris.
Yes.
I hear you have a wonderful, I've seen it actually, it is a beautiful book. Congratulations on guided
Thank you.
surgery. And I would
Thank
love
you.
for you to share with our audience some words about your book.
Actually, this book, initially, it was just a script for as our course material, because we were looking for the material to support our students,
Yes.
how to understand and to bring all the information together. And such a position was missing on the world market. So slowly, step by step, we started to collect all the data and all the necessary information, and suddenly we end up with the book.
Yes.
So we are
Suddenly,
happy. Yes.
It just fell out of the sky.
Yes. So
You
this
make
is,
it sound and look easy, but I'm sure it wasn't.
It wasn't. We published the first version last year in Polish version, but right now it will be available in English. And second quarter of this year it should be available public. And there is everything you should know, starting from what are the differences in between the cone beam and CT, what kind of data you should collect, how to collect, about the STL files, about the planning software, different types of guided surgery, clinical cases, some guidance. So it's easy to read, and it is from practitioners to practitioners, just
Very good.
basic help.
So I spoke to one of our other guests about something that I observed during private practice, where patients perceive a certain value when they see digital systems integrated into the practice. Now, I know that, as I mentioned to our last guest, that you don't purchase digital equipment for this purpose. But I'm curious about your experience in terms of practice marketing and practice building. The more digital you are, do you observe the same, that there's a perception with patients that they value that you are a modern place?
As I may say, me as a clinician with more than 25 years of clinical experience, I see the huge change and the positive change in the eyes of my patients, especially patients who were, let's say, a few years away from our services. When they come right now and they see what we implemented, they see at first that we are modern,
Yes.
that we care with new technologies about them, that we provide the best service. And for them, it is just, they are thinking, I am in the right spot, because we have the integration of the, for sure, experience with modern technologies, which is for patients very important to get the best quality of the service.
Yes.
This is my opinion.
Yes. Dr. Maja, how about you? You're a young dentist. You know, you guys are born these days with gadgets, I think, incorporated into your DNA. So how do you see this from a practice marketing perspective and patient sort of perception perspective? How do you see this?
You know, I love digital, but I also appreciate paper very much. So I didn't know I will
She's an old soul.
jump into the... Yes, exactly. I didn't know I will jump into it so fast.
Yeah.
But I had to go deep water because we've opened our own lab, and I really have to say that as you know, everything that is new, you have to have a learning curve.
Yes.
But it really pays off.
Yes.
It really does.
Yes.
And the patients like it very much, not only because it's less cumbersome for them, because of the intraoral scanner, which is smaller for sure than the normal impression tray, but also because of the wow factor. They can see, they can touch and feel.
Yes.
They, even though that it's on a screen, they can really have a look, and they understand when we're showing them what's the differences. When you
Yes.
superimpose the models on each other, or the scans from different
Sources.
timings,
Yes.
then they can actually see the difference. So they understand what you're talking about, and it's easier to show them on the digital than on two models with a measuring gauge.
Yes. Agreed. Okay. So, Dr. Kris, back to you. Okay. How do you see the future in terms of digital workflows? How do you see the future for full arch cases specifically?
It's very interesting question, actually. And from time to time, we are looking what are the technologies, and right now, IDS is the best place to check what is going on in the industry. And but for me, the future is for sure integration of data, integration of very specific data, like information about the bone, about the soft tissue and the teeth, but as well, I want to have information about the face. But this is only one part of the game. If we would like to go with the full digital protocol, we need to know not only about the aesthetic and position of the anatomy in general, but we need to understand the function as well. So it's important to implement the digital information about the occlusion, about the function in the reliable way. It's still in process. A lot of companies are working on this topic just to implement and integrate this data in a way that we as a clinician with full confidence can plan and deliver the plan into the mouth. Because still there are some gaps which needs to be filled, and I am sure it will happen faster than we expect. So there is no time for thinking, is it right time or no? It is just happening. It is just happening. It's the reality.
Yes. Dr. Maja, what about you? How do you see the future for digital workflows?
Well, I hope we'll be able to integrate it fast and to integrate it properly, because we would love to have an articulator that is reliable on the digital side, and also the condylography, because in our team we have also a great prosthodontist. So she's taking care of the occlusion side. But you know, from the perspective of a young clinician, for me the best thing is the reassurance that I get. That it's the safety, because also when I show my patients whatever we've planned on the software, they see that we did our homework. So the trust is built over time, and they can see that I'm not just trying to do something. It's a long preparation, and I can see, and I'm forced to plan it. So for me, that's much better than without it.
Yes. Now, last question for both of you. Why is Straumann your partner of choice?
There is no easy answer, but I will try to make it short. You must have it. That's it.
Okay, done.
This is short. This is short.
Well, thank you for that.
You're
done.
welcome.
See, Straumann, partner of choice. Okay, Dr. Maja, you. Why is Straumann your partner of choice?
I have to tell you that I'm just beginning my journey.
Yes.
So for me, the most important part is the education and the people behind it, because I have to learn everything, and it's the learning curve is long, as you know, and it's a big difference between we start and when we're experienced already.
Yes.
And young clinicians usually start with cheaper systems, but not as reliable. And for me, the most important part is the education that I get, because I'm sure that there is backup behind it, and that I'm not left alone. Just do whatever you have to, and then I have to make a prosthetics on the implant that I've placed, and I'm unable to do it with other systems sometimes.
Right.
So this is for me a lot of safety again.
Yes. Confidence brand.
Exactly.
Thank you.
Exactly.
And on that note, I'd like to thank Dr. Kris Chmielewski and Maja Chmielewski.
Thank you very much.
Can I tell you how? I think it's adorable that they're father and daughter and work together. We have enjoyed this session. Thank you for sharing your expertise regarding ProArch Edentulous Solutions, and a shout out to my colleague Maria Cremad and our edentulous team at Straumann, whom I have the pleasure to represent today. Thank you, guys. And on that note, thank you very much. My name is Dr. Artemis Atkins, coming to you live from the Arena of Confidence at IDS. We'll see you soon.
Pleasure.
Thank you, guys.
Thank you very much.